Hello and welcome to another rapid revision session. Today's topic is Joseph Lister and carbolic acid, and I will be teaching you today Mrs. Burton. So we're going to be having a look at Lister's methods, the factors which helped and hindered Lister, and the significance of his work. So Joseph Lister was an English surgeon. When he was studying infected wounds, he found that the flesh was rotting. He learned about invisible germs from French chemist Louis Pasteur's work on rotten food. He came up with a theory that if the microbes in the air can cause food and vinegar and wine to go bad, that could maybe also cause flesh to rot. He was shocked that half of patients died after surgery. So he started looking for a chemical that would clean bacteria from wounds, and he read about carbolic acid being used to treat sewage in Carlisle. In 1865, he operated on a patient with a broken leg, and then he added a bandage that had been soaked in carbolic acid, and the wound healed quickly. So from this, he decided to try his method out elsewhere. He developed a whole set of methods to ensure that wounds did not become infected, so that included wiping tools, washing his hands in carbolic acid, and soaking things like cloths in carbolic acid to use post-operation. He also sprayed carbolic acid across the operating theatre during surgery. He published his discovery and he began to persuade others to use the same methods. So there are some factors that help and hinder Lister. Just to remind you, at this time people still believe in the spontaneous generation theory. So why are people not accepting the use of carbolic acid? And many surgeons believe in the spontaneous generation theory, so they don't see any reason to use carbolic spray. Lister is a doer, not a thinker, so he encouraged surgeons to use this carbolic spray, but he did not try to scientifically prove why it had worked. Using carbolic spray slowed surgery down. It made the problem of blood loss worse, so it put surgeons off. So why then did attitudes start to change? By the end of the 1880s, most surgeons had finally accepted germ theory. They understood that Lister's work was important, and they started to accept that they needed to use antiseptics. They came to see it as their duty to perform safe surgery. So why was Lister's work significant? So before Lister introduced carbolic acid, surgery was very dangerous. There was a really high death rate, as we've mentioned earlier. Surgeons wore their bloody and unwashed medical clothes as like a badge of honour to show how experienced they were. Medical instruments were very rarely cleaned and staff never washed their hands. So when surgeons started to use Lister's methods, they started to use carbolic spray together with anaesthetics, so they used chloroform. So for the first time, surgeons are able to perform surgery inside the torso safely, and the death rate in their operations went down. Here we kind of solved two of the big issues. We have covered sort of pain, and we have sorted out the issue of germs. Other surgeons started then to build on Lister's work, so they started to develop further methods of preventing infection. And by 1900, they developed something called aseptic surgery. That is where surgery is performed in a completely sterile room, and there's very little risk of infection from germs. It did, however, take a long time for surgeons to take Lister's ideas on board. They believed in spontaneous generation, so they didn't see any reason to use carbolic spray at first. So now we've looked at the content, so you can do some activities now to consolidate your learning. So you can take the rapid revision multiple choice quiz on this content. You could make a spidergram of your own showing Lister's work. You could also watch this video about Lister's life. You could talk about why Lister's work had an important impact. So you could write a paragraph to make a decision about how important it was. You need to explain your reasons. You need to think about what you have learned about why Lister's work was important, how did it make a difference. But then you also need to show some balance. Was his discovery immediately accepted, or did it take a little while for it to become accepted by doctors at the time? Thank you for listening. I hope that you enjoyed this, and don't forget to check out our other rapid revision videos.